A lot of this violence, and a lot of it is verbal, been yelled at, have things thrown at them, things like that, where we see frustration from the public, from patients, from their families.
Incidents of abuse and violence against staff and nurses at Winnipeg hospitals has peaked during the pandemic. The union that represents nurses in the province wants to see more done to protect those working on the front lines.
Patients are laying in emergency on a stretcher for 36, 48 hours waiting for a bed. And you know, tempers get short, and I think that the public is really starting to become frustrated with the situation in healthcare.
Manitoba Union of Nurses President Darlene Jackson says the government's austerity approach to healthcare is a factor in the rise of abuse, which ranges from verbal threats to life-threatening assaults like the one at Seven Oaks Hospital late last year.
There's a full gambit, but it doesn't really matter what type of violence or abuse it is. It leaves nurses feeling unappreciated. It leaves nurses, thinking to themselves, why am I doing this?
Between 2013 and 2021, there have been roughly 3,800 reports of violence or abuse towards staff working in Winnipeg hospitals. 2021 seeing the highest number of reports by far during that period. 559 incidents of abuse were reported last year, an increase of 37% over 2020. Jackson says patients are fed up with a healthcare system that's failing them and are taking it out on the front lines.
Individuals and the public, I think, are to the point where they're frustrated, and this pandemic has just increased the amount of frustration.
Among Winnipeg hospitals, the Health Sciences Centre logged the most incidents of abuse and violence since 2013, with 2,055 incidents. Asked about the increase in abuse and violence, Health Minister Audrey Gordon says the trend is concerning.
It really saddens me, to be honest, and it's unacceptable.
Gordon says the government is willing to work with stakeholders on the front lines and within its own workplace safety policy to bring those numbers down.
To look at ways that we can eradicate that. It is totally unacceptable, and we want our healthcare workers, our nursing staff, our physicians to feel safe when they come to work and as they move throughout the community.
She says conversations on how to increase safety with nurses and other stakeholders are already underway, saying that dialogue will continue and grow.
About what is happening on the front lines and looking at innovative and creative approaches to addressing it. Again, it's never acceptable to lash out, threaten a healthcare worker, protest outside of our hospitals and block patients from accessing care or making anyone feel any type of threat in the workplace.
Opposition NDP leader Wab Kinew says the hostile environment is just one more sign of an under-resourced system.
It's a real shame that the cuts that we've seen from the PC government over the years has stretched our healthcare system to the brink to such an extent that we now see these sorts of things happening in the workplace that's actually increasing risk.
Saying there's been a significant investment, Winnipeg Regional Health Authority and Shared Health Manitoba say safety is a priority. They are hopeful a provincial standardized facility management and security plan currently being developed will improve facility safety even further. In Winnipeg, Modjeski, City News.